So hello, everyone. My name is Stanley Nyochi, and I'm your host for the day. So I work as a director of sales at a $10 billion semiconductor company in the Silicon Valley in California. And I am the networking contributor on a Professional Africa. Professional Africa is the premier collaboration platform for the development of Africa and emerging economies. It offers over 200 professional development and financial market courses to private and public entities. This webinar that we've been a part of is a series called Lifeline. It is a place of hope in the midst of the gloom of COVID-19. It's designed to strengthen the success of the individual and the corporate entity through quality knowledge sharing like this one. We will discuss health, power, employability, and more. So our webinar today is the second in the series, and we have the pleasure to hear from Dr. Maria Akani, the Managing Consultant of Renaisense Limited, an active mental health clinical practice operating out of Lusaka, Zambia. She holds a master's degree in medicine, particularly psychiatry, and a second master's degree in clinical neuropsychology. Maria is an enthusiastic life transformation expert who works with both individuals and groups to facilitate positive change. Maria, really thank you for speaking to us about this important topic today. The mic is yours.
Thank you, Stan, and thank you for inviting me to talk about something that I'm very, very passionate about. And I'm sure as we go on, you'll understand why I'm passionate about mental health and why I believe that, it's totally essential to the core of who you are as a person. So this is the outline of my presentation. I'll say a bit about my background, and then we'll talk about mental health basics, global statistics and approaches, and then we'll also talk about the history of mental health. And then I'll talk about the local perspective, because I feel that it will give an idea of what's happening in sub-Saharan Africa. And then we'll talk about benefits of mental health clinics to communities. And finally, future work in mental health and what we hope that will look like. So just to say a bit about myself and how I found myself here, I came from a situation so I've been practicing mental health for over 10 years, 11 years. And in practicing mental health, I was working at a particular public institution. And what I noticed is that because of all the stigma that we have in our society, we ended up seeing people in their worst state, because people would just not come early enough to get help. And so I constantly felt like I was always mopping the water instead of turning off the tap. And that's what inspired me to get to a point where I said, what if we had a model of care that, reached out to people while they were still far off, instead of waiting until they were really bad. And the issue about that is that, when a person is really in their worst state, the interventions are limited, and they too cannot participate in their own care in terms of making active decisions and making active changes. And so also by the time you see them in that situation, they would have lost so much. Some of them had lost their marriages, had lost their job, had already lost their wealth, had even lost their hope and dignity of ever being able to live a meaningful life. So that was crucial for me, because I really, really felt helpless a lot of the times. And that's one of the reasons why we got into setting up a mental health clinic in the community. So I don't need to talk about my educational background, because I think you did a really good job explaining my educational background and how I got here. In terms of mental health basics, people talk about, if I can't be diagnosed with a mental illness, then I'm therefore well or sound. But the truth is that mental health is more than the absence of mental health disorders. It's an integral part of who a person is. So in that regard, there is really no health that we can talk about without mental health, even in terms of physical recovery. If your mental state is not right, even simple things like flu can, just take, well, let me not say flu. Simple things like a cold can take over a month for you to get over because your mental state is not all right. When you have whatever condition you may have, even just fatigue, which you would normally recover from in a day, but if you're stressed and your mental health is not fine, you find that it would take, you end up with things like chronic fatigue syndrome, because your mental state is actually vital, even just for your day-to-day recovery and application. So when we talk about mental health, we talk about even just the ability of a person to engage in productivity. So whether it's socioeconomic factors and or the other things that are important in a person being healthy, we have already talked about how that your mental state affects your physiology as well. So even the biological aspects and the environmental factors and all these things can actually interfere with someone's mental health. So you can see that it's a very well-rounded picture, and you cannot take mental health out of health at all. Neither can you take mental health out of life itself. So one of the most important things that we then have to look at is what are the cost-effective public health and intersectoral strategies and interventions that we can use to promote, protect, and restore mental health. And this is ongoing because, as some of you may be aware, mental health is a field that is still young, and for a country like Zambia, it's still in its infancy. And so there's a lot that needs to be talked about, that needs to be discussed in that regard. In terms of global statistics, an estimated 264 million people have been affected by depression, and for whatever reason, more women are affected than men. Actually, maybe I shouldn't say for whatever reason, because studies have shown that women who are coupled, as in married and so on, are more likely to develop a mental health disorder than those who are not. Whereas, so we might have an idea of why women are affected by depression more than men, but I'll just leave it at that. And also, one of the biggest complications of depression is the actual loss of life through suicide. It's devastating because, I mean, what worse end could you get than the loss of a life? We also have other mood disorders like bipolar, which affects 45 million people in the world, and schizophrenia, which is a very debilitating mental health disorder affecting 20 million people in the world. So basically, approximately 1 in 5 will experience some kind of mental health disorder in their lifetime. And those are very high statistics, really, when you think about it. And we really need to invest in mental health if it's that close to us and it will affect us that much. So in terms of the global approach, when we look at what the WHO defines as health, it's really that health is a state of complete physical, mental, and social well-being. I think the emphasis is mostly, for me right now, not merely the absence of disease or infirmity. So it's more than just not having a diagnosable disease to being at a space where you are at your optimum. So there is this space where a person may have a mental disorder, and there's this space where the person is like at their best ability, but then there's also the in-between. And how we manage the in-between is what determines whether these people will end up at the well side or will end up with a mental disorder, or even that they will be living in suboptimal levels. So that's an important aspect that the global approach towards bringing health and wellness in the world is taking. So also the other vision is to bring the services as close to the people as possible. So whichever government, no matter how rich it is, cannot manage to have a tertiary hospital in every community. So the best way to make sure that you bring these services as close to the people as possible is really through some of these things like mental health clinics. And this approach is so that we can leave no one behind. Everyone should be able to have basic services. Another global approach that's being undertaken is implementing strategies for promotion and prevention in mental health. And we believe that this is critical because it also helps us to manage services that resources that are allocated to treatment of mental health disorders by helping to prevent the mental health disorders in the first place. So I thought I should take you through a little bit of some history about where we've come as regards mental health care, and it will possibly help you to understand where we are now and what we are doing right now. So we can start with what happened in the 1500s and pretty much a lot of time before that. And in the 1500s, it was believed that mental illnesses were as a result of demonic possession. So the mainstay of treatment was exorcism. And as you may know, the world in that time was very, very religious. So ministers and priests and all those spiritists and so on were then engaged in doing these activities and exorcising people. It was like a job. It's something that, you know, they really, really believed in. And then later in the 1600s, people got to a stage where they then said, no, I think that, you know, the problem is not spirit possession. We think that it's something more physiological. So they were getting somewhere in the sense that they were realizing it's maybe physiological. But the point was that they then thought it had something to do with body fluids, so all body fluids really. So what they did is that in order to treat people, they would bleed them. Some of them would be bled at their wrists or something to drain some of the blood, feeling that, you know, if they did that, it would help to maintain some kind of balance within the body. Unfortunately, one of the fluids that they thought was a problem was the cerebrospinal fluid. So they would drill people's heads so that they drain out some of the fluid and restore balance. As a result, a lot of people died, as you can imagine, from those practices. In the 1700s, people started to think, no, it's not body fluids. I think it's something else. I think it has a lot to do with bad behavior. And so because people started thinking it had a lot to do with bad behavior, they decided to lock up a lot of people who had mental health disorders. So they were locked up in prisons, and some of them were beaten up for bad behavior, tortured. There are lots of documentations showing how people were put in ice cold showers to treat them and so on, in order for them to sort of bring them back into shape, because that was not very well understood. After a while, a number of people then thought, look, these people are actually not doing this on purpose. They must be sick of some kind of condition. And so, but then they felt that these people are still not safe to be in the community. As a result, they set up these big asylums where people could go and stay. Unfortunately, things became so bad that people would go and pay to visit these people who were in asylums, maybe watch their behavior and so on. But the conditions in the asylums were also terrible. There was a lot of dirt, and care was terrible because some of them obviously couldn't take care of themselves, but then everybody was put up together for as long as they seemed to have some kind of disorder. And the places began to be crowded, and it was really not a pleasant thing. In the 1900s, when more studies were done and they realized, look, this is a function of the brain. There's something going on with the brain. So they started doing a procedure called lobectomy, where basically they would remove the frontal lobe of everyone who had a mental health disorder. Now, the frontal lobe is responsible for executive decisions, so making decisions and helping a person to decide and focus and plan. And what essentially they did is that people just became a lot more like they were mentally retarded. They were always waiting for instructions and orders. They could do very basic things because the frontal lobe is essential in really obtaining maturity. But for them, it worked because then it meant that, they didn't have problems of violence or whatever other things they had problems with in terms of behaviors. But it still meant that those people could not be productive and could not contribute meaningfully to society. In the 1930s, two things happened. There was the issue of the shock treatments, which is what we now call electroconvulsive therapy. And the way the electroconvulsive, so basically in electroconvulsive therapy, what you do is stimulate seizures in a person. So when you stimulate seizures, what happens is that the brain is throwing impulses all over at the same time, and it causes muscles to contract everywhere in the body. So what would happen is that people would get in such terrible muscle spasms that they would have fractures. They did see a good response in a number of patients, but then the injury was also there, that people ended up with fractures that they then had to recover from. And at the same time, people began to realize that there is a way you can talk to people in order to elicit some kind of recovery. And psychotherapy was started and investigated quite a bit, and people started looking into research in that and trying to find out what can happen with talk therapy. The really revolutionary step was when chlorpromazine, the first medication, was ever discovered, because that meant that they could give people medication and these people could walk around and be safe. And because of that, it then also got to be understood that the brain was an organ that could malfunction and that it can be a source of mental disorders. Also in the 1950s, then people began to understand that actually there is not one mental disorder, because there's some people who seem to act like this and others who seem to act like that and others like that. There could be several, and they started describing different disorders and syndromes based on groups of symptoms that patients were displaying, and also understanding how that some of these syndromes seem to have been responding to psychotherapy as an alternative treatment, but some of them required specific medications and maybe didn't respond to chlorpromazine and so on. So research continued to happen in mental health. In the 1970s, a number of things happened. People started realizing, look, if these people are locked up and they're people, then, in human rights, we should take them out. If they can be given medication and they can live in communities, they can be productive, then we shouldn't lock them up. And so a big wave towards deinstitutionalization happened with regards to mental health, and a lot of hospitals began to close. But an additional thing that happened was that these asylums and mental health hospitals had grown so big that no government could actually manage them because they were just too expensive. And so when they had this option of medication, then they started moving people out of the hospital. In the 21st century, what we're now talking about is not just having people have community mental health, like, not just people out of the hospital living in communities and going to clinics, but also considering multidisciplinary teams. So instead of just having the doctor and the nurse, you have community mental health nurses who are actually going out, who are actually managing the person. You have social workers who are working through the support of the person and getting the family involved so that they support the person. And you have other teams like occupational therapy who are helping rehabilitate the person so that they can understand what skills they can be involved in and become productive and apply themselves and so on. So in the 21st century, that has been one of the important things. And then today, we are now talking about holistic care. So it's not enough that a person doesn't have a disorder and is in this period where they're just okay. We're talking about optimal wellness. And when we talk about optimal wellness, we're referring to the 8 dimensions of wellness, because we don't want to just have a basic human being. We want to have human beings at their optimum and productive. And so just to go over what these 8 dimensions of wellness are, it means intellectually, is a person able to think, apply themselves, and adapt to situations using their cognitive functions? Socially, having meaningful relationships, being able to connect, having the relevant social skills that are relevant for the person to actually live in community. And spiritual, so that they have a deeper meaning for their life, because a lot of having meaning and purpose in life has to do with one's spiritual connections and spiritual beliefs. Emotional, so that the person is able to deal with all their internal conflicts, whether it's forgiveness and grief and hurt and so on, and things that they may be dealing with, stress, all those things. And then environmental, are they in an environment where they can thrive? So the environment can be crucial in terms of different things. First of all, some areas have a lot of pollution in terms of noise or what they're breathing, and they're constantly affecting how well a person can be. And then also financial. So being at a space where a person can be able to manage their basic needs. So they don't have to be rich, but poverty definitely brings in a lot of disruption in a person's life, even in terms of their emotional health or intellectual abilities and so on. So being at a space where a person can financially be able to take care of their basic needs. And then occupational, being in a situation where a person can meaningfully contribute to society. That is one of the things that helps a person to be at their full potential, when they're productive and they can contribute meaningfully to society. And of course, physical health, because we can't talk of wellness if a person has some kind of infirmity in their body. And so this is where we're at now, where we are talking about holistic care. I hope that's clear, because I will be referring to it again at some point. So in talking about the local perspective, I just want to say a bit about where I'm from. So I come from a country called Zambia. In the picture there, it's right in green, and it's in South Central Africa. And a lot of what happens in our country is very similar to what happens in many of the countries around us in sub-Saharan Africa. And I thought it would be helpful to just be able to discuss that. And of course, this discussion would not be complete if I did not mention that Zambia is the host of one of the 7 wonders of the world, which is the mighty Victoria Falls. And I'm very proud of it. It's a beautiful place. I've been there so many times, and it's a very good place for wellness and reflection as well. So in terms of our country, it has 17 million people. And those 17 million people are serviced by 10 psychiatrists. That's a ratio of 1 to 1.7 million people, 1 psychiatrist to 1.7 million people, against the recommended ratio of 1 psychiatrist to 100,000 people. So we definitely fall short in a lot of ways. And we have 1 tertiary hospital as a country. We also have a few units, like we have 1 at our teaching hospital and 1 unit at a first level hospital right in this town. A number of the provinces also have mental health units, but most of them are manned not by psychiatrists or doctors, but most of them are manned by medical assistants. So these are usually people who have a diploma in medicine. And to be honest, some of the units are actually not actively functioning right now. The services that are available at these centers are basic psychiatry services most of the time. So we don't have psychosocial counseling happening, and much less for psychotherapy even. Usually you find psychotherapy can only happen at the 2 hospitals. And I'm talking about government facilities. There are a few private facilities which are able to offer psychotherapy as well, but like I said, limited as well. And so from this, you can see that there is limited access to mental health services for the population, very limited access. And the services are mainly located in big cities, city centers. So the people in the peripheries don't even have that access to some of these services we're talking about. That means that they have other alternatives that they use to address their mental health problems, such as alcohol and drugs. So they self-medicate on that when they have problems, and we do have quite an alcohol problem here. And then also we have religious leaders, and people also get involved in various types of spiritisms that sort of, that's where people go for help because their services are just not there. So you can see that the competing alternatives are not always great. And of course, that is a problem in itself because then it will affect the general wellness of the community. So we definitely need mental health clinics in communities, loads of them, not just a few scattered here and there. And I'll tell you what some of the benefits. Well, first of all, early treatment, because when you have a tertiary hospital, like I said, it can't be in every community. So you find that tertiary hospital, so you need a smaller hospital, which will be in the area that a person lives in. One of the problems that we have experienced a number of times working at even our tertiary hospital or national hospital is that we sometimes have patients that do not come for reviews and get follow-up medication because they don't have transport to come. And so when you have mental health clinics, some of them don't even have to get on a bus to come to a service because the clinic is right in their community. But that also reduces stigma because people are able to come early before too many of the symptoms are showing and people are labeling them, before too many losses happen, before they lose their dignity and self-respect. Also, having mental health clinics in communities helps in maintenance of treatment and care, as I said to you, because the service is nearby, it's easier to access, and adherence is improved. So people manage to stay on the treatment longer and we're able to eliminate symptoms so that the person becomes productive. We also have reduced admissions, which is a great thing for the person, for example, because a lot of time is lost being admitted in hospital. I mean, I'm not sure which country you're listening from, but I'll give you an example of what happens in our country. When a person is admitted in hospital, they will be in hospital for some time and already they've lost out that time. But usually their relatives also have to come to the hospital and check on the person. And that means that their relatives are also investing in transport money to then come to the hospital and see the person. And everyone is losing a lot of resources because they have to take time out of their jobs. And some of these people sell at the market. It means that they have less sales because they basically were trying to look after their relative who is admitted in hospital. Then also, because we have reduced admissions, we have reduced health financing costs for both the government or insurance companies or whoever is paying for services, because then there are less admissions in hospital. And the disease burden is greatly reduced in any community when that happens. It also becomes a reduced cost for the patient. Remember, I already talked about some of the costs in terms of transport and lost hours in productivity. A lot of our population is involved in informal employment. So every day counts while they're away from their day-to-day making money. But apart from that, just the cost of the people from home coming to see the person and so on. And then support for families is increased because then they can easily be involved in the care of the patient. They can ask their questions. They too can be able to understand how exactly are we supposed to relate to this patient. Hospitals are not the most approachable places, but community clinics are a place where families feel like this is ours, this is our lot. We can go there and ask questions. The other important thing is that when we have mental health clinics in communities, we can easily incorporate them into integrated care with other community activities. So for a developing country like ours, our hospital has basic services. So some of the things which are needed in recovery and rehabilitation, such as spiritual connection, are not there because the hospital doesn't have a chaplain. But if a person is recovering in the community, they can access a priest or whatever spiritual source they need to. They can also access their social support because they're constantly with their family. Maintenance of the client is better because there's only one person that they're focusing on. They're able to go to the gym and exercise and participate in all the different activities that are needed in helping the person recover and be rehabilitated. So, in terms of future work and opportunities, one of the most important things that we still have a lot of work to do, especially in sub-Saharan Africa, is to demystify mental illness, to demystify mental health so that people can understand, just as, at some point people had to understand that the brain is an organ, it can malfunction. And if the brain's role is to help a person think, feel, and act, then obviously if they have a disorder there, it will affect the way they think, feel, or act. So that's an important thing that we still have a lot of work to do in. We also need to still decriminalize suicide. So on paper, it has been decriminalized, but I can tell you, for example, in our country, Zambia, there's still a lot of people who will pick up a person who has attempted to take their life and take them to the police station to be arrested, so to speak. And obviously, I cannot overemphasize the kind of trauma that kind of person goes through just trying to recover from whatever it is that traumatized them enough to want to take their life in the first place. But we still have a lot of work in that aspect. We have to increase awareness, just helping people to understand that apart from the fact that mental illness is this, there is actually interventions and there are ways in which it can be managed in such a way that we can restore productivity to individuals. We also need to not only give the service, but we also need to give quality services. So it's not enough to just give services. Going beyond, we need to go to a place where we will have excellent service for mental health. It would definitely improve accessibility. It would definitely improve even some of the stigma around people wanting to get care. Leaving no one behind is the plan, really. So moving towards wanting to have this quality mental health service is something that will entice everybody rather than looking down at it as something that you only need when you're really not good for anything else in society. Another important thing is, so our colleagues in developing countries have realized more than anything that actually recovery for patients happens quicker when they're at home and connected in their families, because there's also better involvement from their families. They get to understand the conditions and help with compliance. But even for us here in developing countries, really, we need to strengthen home care because we do not have that can go everywhere. We can't have a mental health nurse and a social worker going everywhere and doing that. So we need to incorporate more of these relatives in home care. But home care also means that we still have to invest in the community mental health nurse, in the community social worker who's going to be able to do a home study and do follow-ups. It's still a lot cheaper than having admissions, and it also helps in prevention of mental health disorders in terms of complications and things like that, because you're able to treat early rather than wait for the person to come. So when we talk about future care, future work, it's really not just about having the mental health clinic there and waiting for people to come, but now moving to a situation where we have the mental health clinic there, but we have these social workers now going out to meet people in their homes instead of just waiting for them to come. And finally, the most important thing that we need to strive for is the holistic care, which I already spoke about in terms of the 8 dimensions of wellness. We need to move from just being content with people being asymptomatic to having people who are fully productive and working at their optimum ability. I hope that makes a lot of sense. So at this point, I would like to stop and ask if there are any questions.
Thank you very much, Dr. Akani. That was an enlightening session. Thank you so much. In a few minutes, we'll be taking questions and answers. Please type in your questions in the comment box. While we collate that, please enjoy this video.
So now I'm on the professionalafrica.com website, and I'm going to just show you a little bit about the website. So here on the homepage, we highlight a few featured events, courses, and certificates. And very important to note is that we have a number of courses and certificates by category. The categories are listed here, from finance and entrepreneurship to human resource management to women in business. So how can women improve? We just heard today that women, especially married women, are more likely to develop mental health problems than others. And so when you talk about the workplace, what can women do to improve themselves there? We have courses in that area, as well as in other areas here listed. Then under videos, we have different videos. For instance, the video from Dr. Akani will be posted on here at the end of this session. And in here, you will find also different talks by our global experts in different sectors of the economy. So when you do have some time, please visit us at professionalafrica.com and make use of the website to its fullness. Now I'm going to transfer it back to Ruka, and Ruka will ask the questions that have been raised for Dr. Akani. Thank you.
Thank you very much, Dr. Rena. Hello, Dr. Akani.
Hello.
Okay, here are the questions. Thank you all for staying with us. So beginning straight to the questions now. The first one here is this. What is psychotherapy?
Okay, so psychotherapy is a type of talk therapy, basically, in which a person is treated for a mental health disorder, but no medication is used. Instead, there are certain techniques that a person uses in order to draw out the person, in order to help them to reflect on who they are, and then come up with strategies together with the therapist on how best they can deal with their condition and move forward. So it's a type of counseling, but it's advanced because they use psychotherapeutic techniques, which are actually have been researched, and yes.
Okay. Next question is this. What is the difference between a therapist and a psychiatrist?
Okay.
Did you get that?
Yes, I did. I'm just amused because you already asked me that question a lot. So it starts firstly from the training. In terms of training, a psychiatrist is a medical doctor. So they have to be a medical doctor first.
Okay.
And then after after they do their medicine, they then have to do a specialty in psychiatry. So then study mental health. And in being a psychiatrist, that means that they can prescribe medications, they can order investigations just like a doctor does. So order a CT scan if a person has a mental health disorder, order a drug tox screen, check if there is maybe a physical illness that is causing the mental health problem, and so on. So the psychiatrist does those things. Whereas a therapist can be two things. So therapist is loosely used because we have a psychologist, and a psychologist is basically somebody who has a degree in psychology and then has a master's, which have probably studied as a clinical psychologist, or it could be an organizational psychologist or something, but after their master's and their special. A psychotherapist can actually go into psychotherapy without necessarily having done a degree in psychology. So for them, they go straight to focus on the skills that are involved in helping people.
Okay, so do we need the both of them, and at what point do we need them?
Do we need both the psychiatrist and the psychologist?
Yes, please.
Okay, so there's some mental disorders that will not even reach the psychiatrist because psychotherapy is enough for them. And then there's some mental disorders which a psychologist cannot proceed at all unless a psychiatrist has prescribed medication for them. So that is necessary in order for a person to get to a stage where they can apply themselves and so on. And then also at a certain stage when disorders are not so severe, so maybe they're moderate, but not so severe, it has been shown that actually having adjunct therapy is the best, like being able to be on medication and still do psychotherapy. Because being on medication, depending on the condition that a person has, being on medication works faster. So medication will work within a week or so. And sometimes when you have somebody who's very depressed, for example, and you're afraid that they might be suicidal, you want to get them out of that situation quickly. Therapy takes time. The good thing though about therapy is that it teaches you the skills, so it prevents relapses more because a person starts to learn the skill of how they can manage themselves. So I hope you can understand there how both of them are absolutely relevant.
Okay. Now, how can you tell you have found a good psychiatrist?
That's a difficult question. First of all, in this part of the country, we don't have that privilege. If you can just find a psychiatrist, then you know you that's important. But I think that for me, one of the most important things, especially with mental health, is the relationship. So in finding a good psychiatrist, the most important thing is that you should be able to build a relationship. They can't be brisk and take you off quickly. They have to take time to understand your history, to understand where you've been, but also to really build a relationship with you, because the therapeutic relationship is one of the biggest predictors of recovery of any mental disorder, whether with a psychiatrist or with a psychologist or a psychotherapist.
Okay, thank you. Now, how important is it to tell your psychiatrist how prescribed medication makes you feel?
It's very important because actually, so where I live here in Zambia, you have the traditional relationship of doctors and patients where in a lot of cases, of course, we still have some cases that people are a bit different, but in a lot of cases, the relationship is more directive rather than collaborative. So the patient just sits there and really just waits for you, the doctor, to say everything. But it's important for a person to understand that the doctor is no good if the patient is not there. So if the patient is not able to say exactly what's going on and talk about what's working and what's not, the doctor is not like, you know, a witch doctor who's going to just guess that, you know, this is working for you, this is not. And one of the biggest problems we've had, for example, in psychiatry is that Sorry, did you hear me? Okay.
Yeah, I can hear you.
Yes, I was saying one of the biggest problems we have in psychiatry is that some of the medications may give people side effects and they will not talk about them. For example, an important side effect that may happen to people is the loss of sexual desire or sexual dysfunction, which is very serious. But then if a person is not telling you and talking to you about it, they'll just keep pretending they're taking the medication, or they'll just be lost to follow up. And yet there are other medications that a person can give to help with a problem. So it's very important that, you know, the patient is talking to the doctor and explaining, this medication makes me feel so nauseous and it's very difficult for me to take it, or it's affecting me. I sleep all the time and I can't concentrate on my work. It's very, very important because, like I said, we can always change medication, tweak some things to see what can eventually help the person.
Thank you so much, Dr. Akani. To everyone listening, thank you for joining us, and thank you very much, Dr. Akani, for sharing with us today. If you have unanswered questions or more questions, please log on to our website at www.aprofessionalafrica.com. I'll take that again, www.aprofessionalafrica.com. Click on Dr. Akani's video and drop your questions in the comment box. So what do you do if you have more questions or unanswered questions? Go on our website, www.aprofessionalafrica.com. Click on Dr. Akani's video and drop your questions right there in the comment box. She will attend to them later. And guess what, people? Next month, we'll be talking about physical health. Join us again September 2nd, 2020 for another educating session. We'll be discussing how to manage diabetes to resist COVID-19 and pandemics. You don't want to miss this. Make sure you invite your friends. Thank you very much for joining us.
Thank you, Dr. Akani. Thank you, Ruka. Thank you, everyone.
You're more than welcome.